Next, let's meet Sarah Mojazza, physician assistant with Novant Health Oceanside Family Medicine and Convenient Care. Welcome, Sarah. Thanks so much for being here today.
Thank you for having me.
Great. Now, I understand that you're a PA.
Yes.
And I'd like to know a little bit about your education and your background. So where did you grow up?
Well, I was born and raised in Utah.
Nice.
And I went to school, did my bachelor's degree at the University of Utah, where I majored in education, health promotion and education with an emphasis in emergency medicine. I got my firefighting and emergency medical services degrees there. So
you were a firefighter?
Yes, I was. And, probably one of the smallest ones you've ever seen, which made it really easy to get through the studs between the walls. But I had a real knack for that trauma side of things.
Nice.
I really liked that. And then while I was doing that, I worked with the little babies on the mom-baby unit for a while and really enjoyed that.
You have a very varied background.
Very broad. And then I went to PA school at Hofstra University in New York for 2 years,
Nice.
and now I'm here.
Great school. Well, now that you're here, what interested you in coming to this area?
You know, I was on my way to New York for PA school.
And you just dropped by.
Yeah, quite literally. I actually had never traveled much, and a friend said, hey, go to Charleston, South Carolina. So I did, but it was the middle of August. It was really hot, so I didn't quite like it at the time. I do now. But then I moseyed on up here, drove right to the waterfront, walked on the beach, fell in love with it, and we've been coming back ever since.
Wow, that's interesting. Well, we're really certainly happy to have you here and in our area. For our viewers who may not be familiar, can you share a little bit about the Novant Health Oceanside Family Medicine and Convenient Care where you currently work?
Yes, so we actually have quite a large practice. We have family medicine providers, we have doctors, we have nurse practitioners and physician assistants, and then they provide care across the spectrum of all ages. With any primary care needs, you have anything from diabetes to sports physicals and wellness checks, and then on my side of the clinic, we have...
well, let's talk about your side of the clinic.
Yeah.
Is that the convenient care?
Yes, so I do more of the convenient care side of things, and, well, I wouldn't claim it mine, but we all work together. And we do more convenient care, it's
kind of like
an urgent care. Right, exactly. So we call it convenient care because we want
Because it's convenient.
It is. It's convenient. We're open a lot of hours during the day, every day, weekends. Monday through Friday, 8 a.m. to 8 p.m., and Saturdays 9 to 6, and Sundays 12 to 5. So we're open a lot. And you can come in for anything from small cuts, we can do stitches, we can diagnose you with broken bones, we can take care of your sinus infections and your colds and even the flu.
Now, do you have to be a patient of Novant Health Oceanside Family Medicine in order to use the convenient care, or is it open to everyone?
It's open to everyone.
That's nice.
Yep, whether you have insurance or not.
Yeah.
Everyone's welcome to come. And but it is a nice perk for the patients of our clinic because their own doctors are there and all their records are there, so we can check and see what they've had done and kind of follow up on their care. So
right. Well, what kind of services are typically offered in convenient care?
So, like I said, we do stitches. We see broken bones. And
so, like, if I went to the beach and cut my foot on an oyster shell, that's perfect.
Yep,
right?
we can handle that. If you have a cold, a sinus infection.
How about people here on vacation and they get hurt or whatever, and that's an option for them too, right?
Yes, minor injuries. We would encourage you to go to the emergency department for things like active chest pain.
Right.
If you're really having a hard time breathing.
Right.
If you have a really deep cut, things like that. But pretty much other than that, we see a lot of stuff, and we're happy to see you. And if we can't handle it in our clinic, we will send you
Yeah,
to
that's
people
what
who can.
Yeah, I wanted to ask you that. So you could have them transported or
We can.
sent to like the emergency department
Right.
if it's something that should
If
be
it's something
seen.
more serious.
Yeah. Yeah. Now, you said you see patients of all ages. Is that correct? So you see children and
Yep.
babies and
Babies on up, yeah.
yeah. Well, I'm curious, what interested you most about working with Novant Health, Oceanside Family Medicine, and Convenient Care? Was there something there that just intrigued you? You thought that would be a good fit for you?
Well, I love this area. I love all of the people here. Everybody's just so
nice. Yeah.
Right. And, I've worked for a big hospital system before back home, and I loved it. Everything was so organized. I went to interview there, and everybody from the doctors to the nurses to the other providers, nurse practitioners and PAs, to the secretaries up front, everybody was just so incredibly nice.
Yeah,
everybody,
they were very nice.
And just working there, everybody is so good at what they do and so helpful. So that's what I love about Novant itself. And it's such a big network. So if I need to send somebody to orthopedics or to a hearing and balance place, I know that we have connections with somebody that we can get them seen, in a timely manner.
Mm-hmm. Yeah, that is really nice. And I love with the the EMR system, the Epic system that we have, that everyone can see those records, and it's just so seamless. You go to another physician and they've got all the information right there. You don't have to remember it in your head so much. So that's great. So you seem like you love the area and you have so much energy. What do you do in your spare time?
Well, I love to fish. That's one thing that drew me down here. I do a lot of fishing from the pier and from the beach and from the boat.
Nice.
And then I do a lot of woodworking.
You build things?
Yes, I build things, furniture. I build all sorts of cool things. Signs made out of wood. I just built a porch swing, dining room tables, that kind of stuff.
Wow, you are so interesting. You have so many facets about you. You're a great person to talk to. Well, before we wrap up, is there anything else that you'd like to share with your patients out there?
No, I think that's great.
Good. Well, great. Thank you so much for being with us today. You've been so interesting, Sarah, and I look forward to speaking to you again.
Thank you.